Hi, I'm Cindy Rubin. I am the founder and owner of In Touch Pediatrics and Lactation, a small home visit pediatrics and breastfeeding medicine practice outside Chicago. I've been asked a lot by parents over the last few weeks, what is RSV and should we worry? So, RSV is a virus, a common cold virus, in fact. We usually see it in the wintertime, and we see it every year. This is not a new virus. The interesting thing is, before COVID, we really didn't check kids who came in with common colds for RSV. We didn't check to see if it was RSV because it wouldn't really change our management at all. Testing costs something, and if it's not going to change your management, there's no reason to do it. But generally speaking, you come to the doctor with a common cold, you're not going to be checked. Right now, or since COVID, we are checking because we need to know whether it's COVID because there are specific things that go along with having COVID in terms of staying out of school and other things. Essentially, people come in with COVID, they may just get a test for COVID and maybe for the flu also, but there's these panels of testing that test for a lot of different viruses. And that's the tests that usually don't do. So now people are coming in, really, we're just looking to see if they have COVID, maybe the flu, and we're seeing exactly what viruses people have when they have these common colds that we used to not know. So RSV, as I was saying, so it's a virus. It causes a common cold in older kids and adults typically. It doesn't cause severe illness. And so those are the kids who certainly we would never know have RSV 3 years ago. Those people would not have it tested. So now everybody's just hearing about RSV because that 5-year-old who typically wouldn't have been tested for it is getting a test for COVID. It comes up positive for RSV, and now you just simply know that it's RSV, and you go tell your friend, "My kid has RSV," and everybody hears about all of the RSV that's out there. So that's one reason why we're hearing about it a lot more this year. Another factor is that our immune systems are working a little bit differently than they did in the past. We haven't been exposed to as many viruses and the same pattern of viruses as we had been fairly regularly a few years ago. So even the viruses that we do usually see are acting a little bit differently. So the other reason why we're hearing about it right now is because it is causing somewhat more severe illness in people who it usually doesn't cause severe illness in. So usually we are most worried about the infants having breathing problems from RSV. Right now, we are seeing older kids, just healthy kids, no asthma, no other underlying conditions who are getting very sick and needing to be hospitalized. So that's a way that it is different and it is concerning and it is potentially leading to there being more kids in the hospital right now because there's this whole group of people who usually wouldn't really end up in the hospital with this common virus, but they are. Things that we typically see with a typical case of RSV. So, the vast majority of even babies, but also older kids and adults, are going to simply get a common cold. Congestion, cough, maybe some fever, feeling run down for a few days, and then it's going to resolve on its own. That's going to be the vast majority of people. Typically, in babies, they can develop something that is called bronchiolitis, not bronchitis, but bronchiolitis. And this is a condition where often there's wheezing associated with it and more rapid breathing and sometimes what we call retractions, which is when you can kind of see the skin in between each rib in the front kind of sucking in because the baby's working so hard to breathe. So this is a common thing that we see with RSV in babies. You can get it with other viruses, and in fact, we were seeing this condition sometimes with COVID, but it's kind of a classic presentation for the babies and kids who do need additional care more than what you can do at home. Another symptom, of course, of colds is a cough, and the cough of RSV, especially in babies, can be a very specific sounding cough. It almost sounds like your baby's been smoking cigarettes for 100 years. It's a very kind of harsh smoker's sounding cough. And so we kind of learn to recognize that when we hear it in the office. But bronchiolitis can be mild, can be severe. Oftentimes there's wheezing associated with it. And again, sometimes that rapid breathing and appearing to look like they're working really hard to breathe. But another thing we'll often see is a baby who is doing all of those things, but is happy and playing. And, if you look at them just from here up, they are fine. They don't look sick at all, and it resolves on its own. But occasionally that can be severe enough where it leads to just increased difficulty breathing, babies having to breathe so hard that they almost start to tire out from having to work so hard to breathe. And that leads to drinking less, which leads to dehydration and exhaustion. And it's when we think a baby may be on the way to that, or if they present already looking like that, that babies will get hospitalized. So those are the symptoms of RSV, but what can we do for it? Well, unfortunately, this is one of those frustrating things as a pediatrician that there really isn't that much we can do. So, the usual things, as I've talked about. So, especially in babies, they often get super, super runny and snotty. So, using a bulb suction or a nose Frida, if you've heard of that, or now you can buy some electric kind of aspirators to help them clear some of that snot, that will just make it easier for them to breathe and more comfortable and easier to sleep and eat and all of those things. A humidifier, that also helps to loosen up everything that's in there, and I tend to recommend a cold water humidifier, mainly for safety reasons, because hot humidifiers or vaporizers, if it tips over, pours on somebody, they could get burnt. You'd wanna treat a fever if there is one, potentially. Again, if that baby is happy and playing, maybe you don't need to treat them if they feel a little bit warm with a fever. But the thing about fevers is that they usually make you feel pretty miserable, and you don't want to drink and you don't want to eat and you don't want to play. So we want our child to be comfortable. So treating a fever, if it's making them comfortable, with acetaminophen or ibuprofen, and keeping an eye on that fever and how long it's lasting is a good idea. And pushing fluids, so making sure your baby's staying hydrated, and that can include continuing breastfeeding, continuing regular formula, milk, regular diet, really, if the kiddo's doing okay. Um, Oftentimes when we're sick, we just don't have much of an appetite, and that's always fine with a cold or any virus. Uh, a few days of not eating is not going to hurt anything as long as a kiddo is drinking. And they may drink less than usual, or they may drink the same, but actually need a little bit more fluids, because that fever and breathing harder can lead to some extra fluid loss that we don't usually have. So you just want to make sure that you kind of keep them drinking, which can be difficult, especially in younger kids and babies that maybe don't understand why it's so important and just flat out refuse. So typically, those are the home treatments. And much of the time, if you come to the doctor, we're not going to really have anything to add to that. Only the wheezing with RSV bronchiolitis that we hear can sound pretty awful, but it actually doesn't respond usually to albuterol, which can be a breathing treatment or an inhaler that we do use for asthma. But in bronchiolitis, classically, those asthma treatments don't help the bronchiolitis. Now, the interesting thing this year is that word on the street is that it actually is responding a little bit more frequently to albuterol. So, maybe we would have a lower threshold to see if albuterol will help. It's not going to help the congestion or the cough per se, but it may help the wheezing and the work of breathing so that a kid can hang in there until their body's able to fight it off. So that's one thing we can offer in the office. Some offices are set up to give babies IV fluids, and that's an option if a baby's starting to look dehydrated. Sometimes you can give them fluids, give them albuterol, send them home with albuterol, and they'll do fine. And that's also something that could be done in an emergency room if needed. Not every baby in the emergency room is going to be admitted. But if they do get admitted, we're still fairly limited on what we can do. We can continue with albuterol treatments if they work. There's a different kind of breathing treatment that can actually help. So that is sometimes something that's given. Also, just with our suctions in the hospital and around the clock nursing, sometimes it's just easier to keep babies desnotted, to really get that congestion out to help them feel more comfortable and drink and breathe a little easier. Sometimes babies just are working too hard to breathe. The treatments we have are not helping them to turn the corner necessarily. And the baby's just getting tired and not doing a good enough job keeping their oxygen up. So that's when they may be supplemented with some oxygen. And worst case scenario is that you're having to put that oxygen so high that you need to intubate the baby, put a tube down their breathing, their airway, and essentially breathe for them until their body can resolve this virus, which sometimes is fairly brief and sometimes can take longer. So those are the most common kind of things that would be done, anywhere from simple cold measures to intubation, which thankfully is relatively rare. So how do you know? Now you're hearing all these scary things that could happen from RSV. How do you know when you should worry? Well, I, as a pediatrician, always tell my patients, if you're worried and you're not sure, call me. This is part of our job as pediatricians. You're not sure what's going on or what you can do for your kid or whether you need to take them in to be seen, call your pediatrician first. So the things that I say, and this goes for RSV as well as just any typical cold, here's what we need to watch out for. Hydration's very, very important. And you can see whether your baby's hydrated by whether their tongue is still moist. If they're crying, are they making tears normally? And you can also look at the output. So how many wet diapers are they having if they're still in diapers? And usually I say 3 diapers in 24 hours. So wet diaper about every 8 hours. Now, older kids, I tend to say twice a day because some older kids only pee twice a day anyway, even when they are drinking normally. The next is that work of breathing that we talked about. And sometimes it's hard to tell, especially if your baby's congested and that's all it is the nose congestion. They still could look like they're having trouble breathing and they are having trouble breathing, but it's all just because of this stuff up here. And if we are able to get it out, their breathing would ease up quite a bit. So if you're able to get it out and even then your baby is retracting, so the kind of chest sucking in either in the middle or under the ribs or between the ribs or sometimes in the neck here with every breath, or your baby's breathing very fast or the belly's really going in and out as your baby's breathing, those are signs of difficulty breathing, and that baby needs to be seen. And again, depending on the severity and your comfort level, start with your pediatrician, and they can guide you as to whether they will see the baby in the office or you should go to an urgent care or an emergency room. The other thing is the fever. So people worry a lot about fevers, but the important thing to know about fevers is that they're not actually dangerous to your child or to you. So your body raises its temperature as a reaction to whatever you've got and actually can help you fight it off by that change in temperature because that virus may not survive as well when the body temperature is at 102. Having the fever is not a worry to me, but length of the fevers can be worrisome to me. How many days in a row has your child had a fever? So, depends a little bit on the age. The younger kids I may want to see a little sooner, like day 3 or 4, because they can't tell us if there's any other symptoms. But in older kids, sometimes that cutoff is about 5 days to see a kid in the office when they're having fever. And it still may not change what we do, but we would want to check, listen to the lungs, see if there's any signs of a bacterial pneumonia, look in the ears, make sure there's not signs of an ear infection or something else that we can actually treat with medications or other things. I forgot to mention, in terms of the breathing, the course of RSV, it typically gets worse over the first few days and tends to peak at about day 3 of the illness and then starts to resolve. So if I see a baby who is already not looking great and they're only on day 1, I'm going to be a lot more worried that this kid is going to progress and need extra help than a kid who's already on day 4 and, that last fever was 2 days ago. They're breathing a little bit hard, but it hasn't really changed in the last 24 hours per the parent, and they are hydrated. I may still send that baby home with the comfort measure. So that makes a little bit of a difference to the physician and kind of knowing that course as a parent and knowing that it is going to get a little worse before it gets better can be really important to know. The other thing would be vomiting persistently. Persistent vomiting, not holding down any fluids. That kid is at some point going to get dehydrated and should be seen. So, this is a lot, I know, but if you've stuck with me this far, hopefully you've learned something about what RSV, why we're hearing so much more about it this year than we usually do, and what to look for. So that's it in a nutshell, in a very large nutshell. What I want to stress is if in doubt, call your pediatrician. There are no stupid questions. Truly, we want to help you take care of your kiddo at home and keep you out of the ER. And we want to see you if you need to be seen. And sometimes it is a little bit difficult to know as a parent, am I overreacting, underreacting? And so call your pediatrician. Always ask your pediatrician if you have a medical question. I hope everybody stays healthy. Wash your hands, wash your hands, wash your hands all the time and until they are raw. I always get bad eczema in the winter because the combination of the cool weather and washing my hands so often gives me eczema. So if you're getting eczema from hand washing, you're probably doing a pretty good job. Have a wonderful day. Bye-bye.